Hello everyone, my name is Dr. Sienna Miller. I'm a naturopathic physician and I specialize in dermatology. I'm currently practicing in the state of Washington, so that's where all my patients are based currently. I make videos all about naturopathic medicine and dermatology and other related conditions, so if you're interested in that type of content, go ahead and follow my channel. Today I'm going to be talking about systemic fungal overgrowth, signs and symptoms, risk factors, associated conditions, and then how we can test for it and treat it. So yeast, candida, fungus, all these things are normally located in our body and on our skin, and they're not an issue until they start to overgrow. That's the case for a lot of things. It's not really an issue until it starts to overgrow, and we'll talk about risk factors for why that might happen. But once it starts to overgrow and crowd out a lot of our good bacteria, or start to cause an infection, that's when we, have symptoms, and it can flare up other conditions, and that's when we really need to address it, treat it, detect it. So I'm going to go by body location and talk about different symptoms that you might notice if you have a yeast issue. We'll start with the skin because that's easy. So like fungal skin infections, that could be tinea versicolor, ringworm, or tinea corporis, same thing. Athlete's foot, toenail fungus, dandruff is usually related to yeast. Next would be digestive symptoms. So really any digestive symptom can occur with intestinal fungal overgrowth. I would say the most common are bloating, like belching, early satiety, acid reflux sometimes. Those would be the main ones, and then especially associated with sugar and yeast rich foods, so like breads, beer and wine, kombucha, those are big ones. Vaginal symptoms as well, if you're somebody who has a vagina, so discharge, odor, itching, recurrent yeast infections, that's a big one. Next on the list, allergy type symptoms. So if you have kind of like recurrent sinus infections, runny nose, post-nasal drip, allergies, especially if you're in like a muggy, damp, wet, moldy environment, that's a big like red flag for that going on. And then just general symptoms as well. I hear like most commonly I'll hear just like fatigue, brain fog, headaches, that sort of a thing. So those are common. And then sugar craving. Sugar cravings is another one. I would say those are the main symptoms. Sorry, my camera shut off on me. I'm sorry if the frame changed, but let's talk about skin conditions and intestinal fungal overgrowth, because that's what I deal with most of my patients. So there's lots of evidence and research out there now linking lots of common skin conditions to intestinal fungal overgrowth, and that's what I am testing for and treating with most of my skin patients. So these conditions include acne, eczema, rosacea, psoriasis, seborrheic dermatitis, I would say urticaria as well, that's a big one, or hives. So yeah, huge link there, and it's definitely like a key piece that I'm targeting with most of my patients. Next, I want to talk about risk factors for why you might have fungal or candida overgrowth, or fungal or yeast overgrowth, I'd say the biggest is probably antibiotic use, so more so with like prolonged or recurrent antibiotic use. I'll see this a lot of times with my acne patients who have been on doxycycline for months at a time, minocycline, just because it really wreaks havoc on like the good bacteria. So, and that kind of goes into the next one. So low levels of good bacteria to kind of crowd out the yeast. A low fiber diet, we need fiber to feed the good bacteria. History of SIBO, so small intestine bacterial overgrowth. I see intestinal fungal overgrowth go hand in hand with, I'm not going to say every patient, but like I would say most SIBO patients also have a candida or yeast issue going on as well. History of mold exposure or like water damage in your home, work, car, that's a big one of having yeast issues. And then a high sugar diet, so eating lots of sugar all the time, lots of yeasty foods, that just really feeds into the yeast issue, so that's another big one. And yeah, I would say another, I should have mentioned earlier, like another like sign or symptom is if you're, all the symptoms we talked about so far, if they flare up when it's muggy out, when it's damp, when you're in a wet, moldy environment, that's another key symptom as well. Mold and yeast and fungus, like it just loves like warm, damp environments. Like that's just what's going to cause it to like grow and kind of go a little rampant. So testing for yeast, it's a little bit tricky. Sometimes it depends on the body system. Like of course, if it's external, that's a little bit easier. You can do a culture. So, nasal culture for the sinuses, skin culture for skin rash. If it's a vaginal infection, you can do a vaginal swab. That's pretty easy. The gut, testing for fungal overgrowth in the gut is a little bit more tricky. Stool tests can be helpful, but they're not perfect. And honestly, if it doesn't show up in the gut, or if it does, it doesn't really tell us too much. I check Candida immune complex or antibodies in the blood work. I would say the best test you can use to check for a mold or fungal issue in the gut is an organic acids test, which is a urine test. It's checking for mold and fungal metabolites in the urine, basically. So that would be my number one recommendation. As far as treatment goes for yeast, of course, there's like lifestyle and nutritional recommendations. I'm recommending like a low sugar, low yeast diet. For antifungal options, there's lots of herbal antifungals. That's what I'm usually using for my patients. Either that or nystatin, which is a prescription antifungal. I like nystatin because it doesn't really get absorbed. It just stays right in the gut. And then fluconazole is the other option. That's what's used, or diflucan is the brand name of that. That's what's used for like vaginal yeast infection. So that's working more systemically. So if this video kind of raised some red flags for you, if you think this might be an issue for you, I recommend scheduling with a provider who has expertise in this area. Most likely a naturopathic doctor would be a great option, or some other type of functional medicine provider. Just make sure they have expertise in this area and they're going to know what to like test you for and check for and how to treat and all those types of things. But yeah, I think that is everything. If you enjoyed the video, please give it a like. Make sure you leave any questions, comments down below. I'm happy to like answer any questions that people have. And go ahead and follow my channel if you want to see similar content, and I will see you in my next video. Bye.